So you've had a concussion, and when you wear a headband or a hat, you get pain in your head. Where's it from? That's a good question that we got from a follower over from Dr. Mark Heisig, and we're gonna answer today. We've got 4 things to think about. So number 1 are the nerves of the face. So we've got the trigeminal nerves that come out. Dr. Heisig talked about this, that can be irritated. So if they're irritated or sensitive and we put compression on them, we have a likelihood of causing more irritation. What we may see is if we irritate them within that line of the hat band, they may refer to other areas, whether that be into the eye, whether that be into the upper or lower teeth, or even into the sinus or in your nose. If you're having pain that goes into those areas, those may be indicators that you're getting compression or irritation on the nerves in your face. That's number 1. Number 2, same concept, but with nerves that come from your neck in the 2nd and 3rd segments. You have ones that come up behind your ear to the apex of your head, and a second set that are dorsal rami that come to the back of your head. And what we can do is by palpating into that 2nd and 3rd segment of your neck, we want to see if that reproduces pain into those areas in either the greater or the lesser auricular nerve are kind of the 2 most common, especially if the pain starts from back here. The 3rd thing we can look at is actually from the muscular attachment. So if we're wearing that headband or that hat low, and it actually interfaces with the connection of the muscles, then the muscles themselves may be irritated relative to how you're positioning your head. So these could be the complexus musculature in the back of your neck, the SCM muscles that come down the front of your neck, or the scalenes that come kind of the middle, back, and front. So again, we can lightly press into those muscles and see if by pressing into those muscles, if I can reproduce that headache, then that'll give me a sensation of whether or not the muscle may be involved in this problem. And then the last one we can think about is the cutaneous vasculature. So you have these temporal arteries that come in front of the ear, and we have branches that come out all over the place. And sometimes people that have headaches or migraine or just have sensitivity in the vasculature, compression of the vessels can cause an irritation into the head. And we want to be careful that we're not looking at giant cell arteritis in these cases. This is where you want to see a doctor for sure. But when we're looking at these, we want to see if there's a pulsatile element to the headache. Does it pound? If it's pounding and that pounding matches your heartbeat, then it might be worth investigating whether or not it's something that's in the vasculature. So I hope those things help. If you're noticing one of these things, reach out to your doctor, get some help. Talk to you soon. Thanks.